Hi, I'm Dr. Tara May. I'm a clinical psychologist and motherhood empowerment coach. In this grief series, I want to talk a little bit about the spiritual, emotional, and physical aspects of grief. Grief is exhausting from a physical standpoint. It takes a lot out of your body. You can think of it as, kind of an ongoing stress response that your body is engaged in. And so, because of that, it makes it hard to eat whole meals. It's exhausting. You may find yourself just physically lacking a lot of energy. It's hard to get out of bed, which can also, be related to the emotional aspects. But grief is just physically taxing. And so it's really important to take basic self-care, drink lots of water, eat healthy meals. You don't have to eat full meals. I remember when I was grieving the loss of my pregnancy, one of the things that I did, I couldn't bear to eat a whole meal. I couldn't even bear to cook. So I would just sit in the backyard and I would eat cheese and crackers and grapes. And that was my sort of go-to food that would just sustain me. And so, it's okay to do that. And whatever you need to do to just keep your body fed so that your body can keep moving forward, and it will help reduce your suffering, because when people don't eat or they reach for lots of sugary or fatty foods, it actually has an impact on their body and on their emotional health, which prolongs suffering. No one needs that on top of their grief. In terms of physically as well, it's really useful for people to take walks, to be out in nature, to just get your body moving, to help just kind of move some of those emotions through your body, and it should give you a little bit more energy. When it comes to the emotional aspects of grief, as you know, grief is a roller coaster. It sucks. I mean, it's hard. Sometimes it will feel like the pain will never end and it's just one big black hole. It does get better. And I would say to be gentle and compassionate with yourself. Feel what you feel. Allow yourself to embrace those feelings and release them. They will come back and you can embrace and release once again. But don't feel like you have to grieve alone. It's important to connect with people. Let people know how you're feeling, trusted people, whether that's through other baby loss parents or expert guidance or a trusted friend or family member. But give those feelings expression. When you're sad, cry. When you're angry, be angry. Just let those emotions course through you. That's the best way to open the door for healing. From a spiritual standpoint, people often find that it's a really big struggle when, you just wonder why this could happen. How could a baby die? It's just such a devastating loss, and so people wonder, how can God do that? Or, do things happen for a reason? Is there a meaning? What reason could there possibly be for having your baby die? So, we all have our ideas about why these things happen or what meaning we can create in them. One of the things that I advise people and encourage people and work with people towards is to shift from why did this happen to focusing on what did happen and how one picks themselves up and continues to move forward in their lives. So instead of what should have been, we think about what could have been and what is, and focusing your grief from there. It really does help to reduce suffering. It helps to reduce some of the emotional pain and stuckness that people often experience. It's a hard place to get to, but the more that you can work in that direction, your journey will go easier. So I hope that helps, and I look forward to talking with you more in subsequent series. Thanks again. I'm Tara May.